Okay, we're live now.
We're live. Fantastic.
Okay, great. Well, thank you very much for. Okay, my name's Malik. Welcome everybody. I'm a licensed acupuncturist, herbalist, and nutritionist. I'm excited, super excited today to have probably sort of the only person probably in the UK that specialises in a particular area of TCM. Okay, his name is Ilkay Chirali. He's an acupuncturist, licensed acupuncturist, and specialist, not just a standard person that does cupping therapy, but he's a specialist in that area. He's written a book, probably more than one book, but I've got his book, so I've got your book.
That's the third edition.
Yeah. I've had it many years ago. It's fantastic.
Yeah, that is the third edition.
Okay, brilliant. Yeah. His website is can you introduce yourself, please?
Yes, I'm Ilkay Chirali. I'm a Chinese medicine practitioner. I use when I say Chinese medicine practitioner, means I'm also a herbalist. I also treat children. I'm also a pediatrician. Treat children particularly with acupuncture and herbal medicine. And of course, one of my passion in this field is cupping as well. So I treat, in my clinic, I treat acupuncture, herbal medicine, and almost 80% people they end up having cupping as well, yeah. whether they like it or not. Because cupping really helps, it promotes the qi and blood circulation, so it helps my acupuncture treatment as well.
Excellent, brilliant. Okay, I know you've got a substantial wealth of experience, not just theoretical. I mean, there are a lot of people out there that write beautiful books, but clinically they don't get very good results, or clinically they don't have that deep depth of experience, which I believe you have. Okay, so. Thank you for sort of joining me again and sharing your experience with us. So what kind of conditions do you get a lot of? What would you treat?
With adults, Malik, mostly musculoskeletal conditions and lung conditions like colds, coughs, it really responds very well. With children, mostly digestive problems, nutrition problems, and you won't believe this, but also asthma, a lot of asthmatic kids. So they also respond very well to acupuncture and cupping particularly. I mean, they prefer cupping to acupuncture because there is no needle.
Yeah. So do I. Good. So with children, how long does a session last?
With children's treatment is pretty short. I mean, acupuncture, for instance, you don't retain the needles in with children. They're in and out. You stimulate what you want to do, either stimulation or sedation, and they're in and out in a split second. And we have particularly very fine gauge needles with children. So also, I mean, with acupuncture, with children as well, we use moxabustion as well, and cupping. Again, cupping, you got to use light to medium cupping with children, and not limit more than 5, maybe maximum 6 minutes on children cups. And of course, with children, no bleeding cupping, no hejama, as we know it as a hejama practice, no bleeding cupping, really.
Okay. And do you get neurological children with neurological conditions as well?
Not much, no. Most of the children that I treat in the clinic are digestive, also respiratory conditions, and some skin conditions too.
Okay. Now, I know the cupping side is you have different styles. You have, I think, the herbal side as well.
Yes.
what I mean, so what would it? So if a person wanted to go to see you, what would they be getting? I mean, the suction or the fire cupping, or what would you do with them, and how would you decide what's best?
As I mentioned earlier, most of my patients coming here for acupuncture, and I use cupping as a auxiliary therapy, as an extra therapy for them. They don't particularly come just for cupping, but I developed 10 different cupping techniques.
Yeah.
In books, they're all listed. In some, I think my first book came out in 1999, end of 1999, the traditional Chinese medicine cupping therapy book. I don't have a copy of that here, but that was 1999. So second edition, it came in 2004, and third edition of the book, which is the one that you're holding, you know, this is the third edition. Some I got 10 methods and some I got 12 methods of cupping. Different methods because everybody has a different condition, and when they come to the treatment also, the energy is not, for instance, their energy is not enough, is not sufficient to have a bleeding cupping or a strong cupping. So you end up, if you do strong cupping or bleeding cupping, sending them out more, worse than they came in. I mean, one of the biggest dilemmas I have is that I have sometimes people traveling from Manchester, Birmingham, Portsmouth, quite a long way to come to London for treatment, and they book for particularly cupping. They want hijama, which I know they want bleeding cupping. And when they do arrive here to my clinic after 6-7 hours of driving, I mean, I really feel for them. They're so ill, they're so weak. They either just had an operation, or they're going to have an operation, or they're very anemic. And I say to them, you are not suitable for a bleeding cupping, for hijama, but you can have dry cupping, which is, you know, it will benefit you. And that's what I do. But I know that they are not happy about it. They want bleeding cupping. They want hijama, which is contraindication for that condition, really. You cannot do bleeding cupping when somebody is very weak or has hematological conditions. So it's a factor that I stress in my teachings all the time, that as we know, the hijama, even in the old days, it wasn't always bleeding cupping. It was also dry, applied as a dry cupping.
Right.
But somehow, the idea that it was always a bleeding cupping is somehow wrong.
Okay, that's very interesting. So I didn't know about that. That's very interesting.
Because the whole idea of cupping is to improve the blood circulation, to tonify the chi, the energy, and get fluids moving, stagnation moving. Yes, if you have rheumatic arthritic joints with stagnation, with swelling, and cupping just moves it. You don't need the bleeding cupping for that. But in extreme situations where you have conditions where the patient is well, is strong enough, you can tell from their pulse, from their tongue, that their chi is good, then, and they must have heat condition. So you cannot do bleeding cupping when they got a cold condition, when the tongue is white, they feel cold, they feel really weak, and they're shivering. You can't do bleeding cupping. It just don't work. It will make it worse for sure. Instead, you have a light or medium warm cupping. Make them feel warm. Apply heat like moxa or another herbal pouches on the body, and warm the patient rather than do a bleeding cupping on somebody who is feeling very cold.
Okay, excellent, interesting. just a side question. We know in the Middle East they tend to want this this wet cupping, the bleeding.
Yeah. Yes.
And the Chinese. I mean, how did they get this idea of cupping? Where did they get it from? And was it in their medicine before?
If we look at the history, I mean, I did extensive research. I mean, I have written 4 books on cupping, so I did extensive research on the cupping, as you can imagine. And the first written documents that I found was from the ancient Egyptians.
Okay.
And I mean, that went back 3,000 years before Islam or before Chinese. I mean, you know, if you, and I have actually seen it myself in Luxor, Egypt. In Luxor, there's a particular a temple which is it's a healer's temple. That in the entrance of that temple, you have drawings of many instruments that the Egyptian doctors used, and amongst the instruments, there's clearly set of cupping materials. And guess what? Made of glass.
Amazing.
Made of glass, you know. So they were the first ones to use cupping as a systematically treat people. Even the Roman emperor, when they conquered Egypt, one of their commanders, when he came back from Alexandria, and he said, "Look, these people are using cupping in this area, and it's so effective." They started teaching the Roman doctors the cupping method way back. We're talking about, you know, I mean, the Egyptians, we're talking about 2,000-3,000 BC. You know, it's not a you know, yesterday's history, is it?
No.
And the Africans, the African nations, whether they were Muslims or non-Muslims, I don't know, but we got pictures of African and nomadic people using horns, animal horns, as a cupping, sucking the air out and treating people with this method. And the British Museum here in London, I have seen pictures of and I have in my first book, I have some pictures of those African people using horn. Now, later on, of course, I don't know how it went to China, to be honest with you, I really don't know. But to this day, in Chinese hospitals, that I worked in Nanjing, in the biggest hospital. I worked there for 2.5 months with the University of Nanjing Hospital. And they use, in the acupuncture department, part of the treatment is always ends up with cupping, always. But not bleeding cupping, dry cupping, mostly dry cupping. Different, strong method, weak method, or it depends the patient's condition, of course. So the Chinese kept this tradition going up to today. And of course, I'm a Turkish Cypriot from Cyprus, and my grandmother, she was a midwife, and her mother also, my great-grandmother was also a midwife and herbalist. And in our house, we always had women with complaints coming in and out, but she would always use cupping on them for various conditions. So I grew up with cupping, seeing cupping in action, really. She would use cupping, for instance, for women that they wanted children and for women that didn't want children. different method. Yes, she would make some herbs, and we were not allowed to go in that room. That she was, her name was Rahmeli, my grandmother. That was my father's mom. So I grew up in this culture, in this cupping, and my mother always, we used cupping as a normal, everybody had a set of cupping set in the house in Cyprus. Turks and Greeks. Greeks call it ventuzes or gandiles, which means glassing. And the Turks and Greeks, we both used it. Now, when I studied Chinese medicine in '83 in Australia, And I saw the Chinese, my professor, using cups, and I said, "Oh my God! I thought that only we use cupping. You know, the Turks, you know, the Cypriots use cupping, but no, this is a Chinese part of the Chinese medicine we use." So I became, in no time, I became kind of a teacher to the other students of cupping, because I knew it. I knew cupping. I could do cupping my eyes shut, you know. So he was also surprised, my professor, that I knew cupping so well. And I told him, I explained to him that in our tradition, we use cupping a lot. But to this day, I cannot have a sort of the connection between ancient Egyptians and the ancient Chinese. How did that happen? I don't know. So, of course, in the when you look at back historically, the Jewish teachings as well, they advocate cupping. In the and of course in the Muslim, in the Islamic tradition, our Prophet used it and he saw the benefit, so he advocated cupping. But in some hadiths, you will find that he is against bleeding all the time. And I don't know whether in this book, or the medicine of the Prophet, I don't know whether you.
Okay.
Medicine of the Prophet. In here, it's a wonderful book, this one. It gives herbal prescriptions as well as cupping prescriptions as well for many conditions. I was invited to Saudi Arabia, to Riyadh, by the Saudi Arabian government health authorities a few years ago, to go and teach there to the paramedic people cupping, because they wanted cupping therapy, hijama, to be part of the integrated health system.
Yeah.
Because unfortunately, a lot of hijama practitioners practice in the streets, in the back streets, you know, in the shops, dirty, not very hygienic, and they want to bring it under control. So I was there for 1 week, and there was they wanted what we did in that week. We developed a teaching protocol for paramedics and nurses, how to apply cupping and how to control, how to teach as well those that they wanted to practice. So they looked after me very well. They were very pleased that I went. I mean, they knew about me, obviously, but they were also concerned about the unhygienic conditions that people practiced in the back streets. Although it is illegal as such, they still practice, unfortunately. But I'm hoping that by now they sorted it out.
Yeah, that's it's. I mean, for me, growing up, it was something new. I mean, I only knew about it, I don't know, maybe 5-10 years ago, cupping. I had it done a few times and I found it very effective, but it didn't last very long. I had the wet blood cupping as well. That's in Spain.
Mm-hmm. Yeah.
And but that's the first time there. But that was really effective. So I remember that occasion I couldn't move. I had low back problems. I couldn't move. And one of the people I was staying with, he practiced that and had a go, and it was really effective for about a week. But yeah, so it's amazing.
You got to do a course. You got to do a course of treatment. Nothing is magic, one treatment. It just, I mean, people ask me how many times do I have to come, and I tell them exactly this. It's not a magic one visit job. You have to have several treatments, and that's it, and then the benefit lasts longer and longer.
Yeah. definitely. I mean, so if somebody wants to say, okay, how many treatments would you? So say somebody calls you, they book appointment. What can they expect on their first day, first appointment?
Now, for instance, say somebody comes with asthma. Yeah. You have a condition where maybe they're on puffers, they're taking, steroids, and they're, for their condition. First of all, you go to see, have they got phlegm? Are they phlegmy? Are they dry cough? Is it, you have to establish what kind of asthma. We all know that cupping benefits the lungs. We know that. I mean, that is established. We know that. But only cupping, you will not get much, you will not get sort of much result just by cupping. You will need, for instance, some acupuncture or some herbs to support get rid of the phlegm, get rid of the, help to get rid of, advice about the diet, what to avoid to get phlegmy, to get rid of the phlegm. And then apply the cups on the ashi points to the front of the lung, of the body, and the back shoe points. So they will expect from me, they will definitely get acupuncture, and they will, first session, they will have maybe about 10 cups, lasting not more than 5 minutes in the beginning. And then second visit, it will last maybe 15 minutes, the cups on them, and so forth. I have been asked about 3 times in the last 5 years to appear in a court as an expert, because people sue the practitioner about cupping, wrong cupping. It wasn't wrong cupping, but they did not explain to the patients that they will get bruises, for instance, that it may be, the bruising might last longer.
Yeah.
So they sued them. They ended up in court. I had police coming to my office, child protection unit from Scotland Yard, because somebody did cupping on the child, 9 years old. The child goes to school with cupping marks. School calls the social services. Social services call the police. Before you know, they arrested the father who did the cupping, and he was in prison for about a week before my report went in and released him. Do you follow?
Yeah,
so
yeah.
It's I mean, to expect what I always tell people, that in the first instance, in the first visit, don't be too aggressive. Don't use strong cupping method. Yeah. Just a light cupping method, so you don't leave too many marks on the skin. And as the body improves, as the blood circulation improves, you can apply stronger cupping, and believe me, it will not bruise. Now, when you do bleeding cupping, again, cut just as my professor used to say, as big as a grain of rice you have to cut. You have to cut as big as a grain of rice, not a couple of inches long. Sometimes, I mean, I see some laceration marks. It makes honestly, how they do it, I just don't know. And the risk of infection, I mean, look at this. I mean, but if you cut a couple of, and we have a special 7-blossom needle in acupuncture that we use with 7 needles, that it's called plum blossom needle. And if you use that in a particular point, you will cause bleeding there, but not massive cut. And with a surgical knife, you cut a small amount, several small amounts, fair enough, but not one long, big couple of inches of laceration, and that can cause infection and also the complications.
Absolutely, and this is why it's very important that anybody that wants this treatment needs to go to a professional like yourself.
Absolutely.
And so in your first treatment will be a mixture of acupuncture, maybe for what, 30 minutes?
Yeah.
and then follow up with 10 minutes of cupping. Now, the nutritional advice, would you give it at that time or another time?
No, same time. I mean, my visits here are about an hour average. Each visit lasts about an hour. And definitely they will have dietary advice as well during that 1 hour. Because if, dietary advice is so important as a practitioner that we got to give them people, because if they eat or drink the wrong stuff, wrong things, doesn't matter what treatment you do, it won't work, or it will take a long time to benefit.
Absolutely. And I think the other important thing that you touched on before was that to remind people that one session isn't going to be it.
Absolutely not. Absolutely not.
I've had someone said once, or a few more than once to myself, said, "Oh, I had acupuncture done 10 years ago or 12 years ago for back pain or something, and just the one session, and that was it." And I thought, well, I felt like saying, "Why are you coming to me? Go back to that person."
Yes. I mean, sometimes, Malik, I've been practicing 35 years. It's quite a long time.
Yeah.
I have seen, honestly, I have seen situations where people, just one visit and their pains disappeared, especially musculoskeletal pain. But they are in minority.
Yeah, rare.
And then some people I try everything I know after 7-8 treatments, and they do not respond.
Yeah.
Now, the way I work is, and in my literature as well, I give to patients, is that it doesn't matter for what they come to me, what I'm treating, a chronic condition, acute or really bad conditions. I advise them to do one session, one course, which is 10 visits, one course. Once a week, it will take 2.5 months. If children respond quicker, so with children they respond about half the time children respond. But adults, they will need one course of treatment at least. Now, what I tell people, if you don't respond in that one course, whatever I'm doing in that 10 treatment, then I call it a day, because that means whatever I am doing, you are not responding. It's no good keep coming months and months and months without any, because it's expensive, it's time consuming. They get frustrated, I get frustrated. Why I'm not getting results, So I advise people when they come here, when they ring me, I said, look, you're coming here, don't expect miracles. Yeah. Are you prepared to come at least one course of treatment and then come? Otherwise, don't expect you got 20 years backache, you will have treatment in one session and everything will be hunky-dory. It won't. It won't. So I explain that very clearly. I make it very clear, because they do ask, because they have to pay, obviously. They do ask how many times I have to come. And I say, well, you have to do at least one course of treatment. And some insurance companies, luckily, they do pay for acupuncture. And some don't. But now some insurance companies do pay.
Yeah, excellent. Lovely. So yeah, I mean, the key thing is to find a professional and to at least have a course of treatment, because most of these conditions are fairly, I've been around with most people for a long time, many years. So, they won't get a quick fix there and then. But yeah, there are those rare occasions where you get maybe the one treatment and it's helped them, and that's it.
Yeah.
Okay. But yeah, I mean, so that's good. Brilliant. Okay, so if one wanted to, so if someone's listening, they want to contact you, how do they contact you?
I got my website is, I think it's Ilkay Chirali.
Okay.
.co.uk.
Yeah, sure. Okay, it's ILKAY.
ILKAY.
CHIRALI.co.uk.
Yeah, I think I got that one somewhere. I'm sure I got it. It's a freebie that I got from Google.
Oh, brilliant, excellent.
I'm sure.
And your phone number, which number should they contact you on?
It's a clinic number. The clinic number is the best number, 0208 306 6736.
Okay, great. Okay, brilliant, excellent. Thank you very much.
Let me see my works. Ilkay Chirali.
Okay.
Ilkay Chirali. .co.uk.
I'm going to show you a book again once again. This is the book.
Yeah, that's the one. Yeah. And this one is in Czech language, Czechoslovakian.
Okay, brilliant.
Wani. This one is the French edition.
Okay.
Vantuz, French edition. This one is the German edition. With this one, you get DVD as well.
Okay.
The German edition. The German edition went crazy last year. They were selling it for about £500. 100 euros. I got, I don't know why. And this is my latest book, Cupping Therapy for Body Workers.
Yes.
Now, this book I have written particularly for non-Chinese medicine practitioners. Okay. This is for massage therapists, for physiotherapists, and sports therapists, okay, where there is no TCM jargon here. It just it gives the practitioner extra tool to use as a, you know, in their practice as a cupping tool. So this is my newest book this is published by Singing Dragon.
Sure.
And all the other ones, of course, they are by Churchill Livingstone or Sevilla.
And so all these books can be found from Amazon.
Yeah, they're all available on Amazon.com. If people put my name down on Amazon.com, Ilkay Z Chirali, all my books will come up.
Sure.
And my aim is really, all these years, I've been teaching now 25 years now, is to try and teach safe cupping methods. So we really, whatever we do with cupping, you will have extra, like extra bow in your string to get results. But the most important thing, we have to think about the patient's health and the patient's safety. So we really mustn't forget that. So please, whoever is listening, when you do cupping, don't be too aggressive. Start with light or medium technique and then increase as you go. And then only use hejama bleeding cupping only if it is necessary. But before we go, I must almost stress that what is not permitted to use, because this is really so important, the contraindications that people really should avoid at all cost. For instance, any cancer-related conditions. People ring me, they say, do you treat cancer with cupping? I says, I don't treat cancer with people with cancer because their condition, especially if they are having a chemotherapy or radiotherapy, the immune system is very low, and you can cause a lot of infection by that. So, hemorrhage of any kind, apart from normal periods, I'm talking about hemorrhage, internal hemorrhage or external hemorrhage. Any anemic conditions, if patient come to visit you, if they're anemic, no cupping, please, especially hejama cupping, bleeding cupping. Again, very young and very old, debilitated, very tired, very ill people, forget about cupping. If you are doing do a bit of massage, bit of herbal medicine to pep them up, their energy before you do cupping. And pregnancy, during pregnancy, avoid pregnancy after 6 months of pregnancy, because it can trigger, it can trigger the
baby
or early delivery that is not desired. Okay.
Great stuff. Thank you very much. Thank you very much
for having me.
Thank you. It's been a pleasure. A lot of information you shared with myself and the viewers, obviously. And
anytime.
So don't go away. I'm going to end this recording now. So just
anytime.